This is a Medicare Madness presentation, When to Enroll in Medicare. Individuals can qualify for Medicare prior to age 65 under special circumstances. One of the ways is to be receiving Social Security disability benefits for 24 months, and then the member will be automatically enrolled into Medicare Part A and B on the 25th month. Another way is to be diagnosed with end-stage renal disease, be receiving kidney dialysis, or have a kidney transplant. There are additional ways to qualify for Medicare. Please contact Social Security for more information. Most people become eligible for Medicare at age 65. You must be receiving or eligible to receive Social Security benefits, which means you or your spouse worked at least 40 quarters in a job where Medicare taxes were paid. Individuals turning 65 have an initial enrollment period or an IEP. Your IEP is a 7-month time frame when you can elect Medicare coverage. This period starts 3 months prior to the month that you turn 65, includes the month you turn 65, and ends 3 months after the month that you turn 65 for a total of a 7-month time frame. If you are already receiving Social Security benefits, your enrollment into Medicare Part A and B will be automatic. You'll receive your Medicare red, white, and blue card prior to turning 65, typically 2 to 3 months before that time frame. If you are not collecting Social Security benefits, then you must enroll in Medicare through Social Security, using their online website, calling in and scheduling a phone interview, or going in person to a local office. A common question that I receive is, can I postpone enrollment in Medicare? The question is yes, you can postpone enrollment in Medicare if you are actively employed and covered under a group health plan, either through your employment or that of your spouse. Your employer must have at least 20 or more employees for the employer plan to pay primary. Retiree coverage through an employer does not count the same as active coverage, and COBRA coverage also does not give you a waiver to enroll in Medicare. I've had several situations where I worked with individuals that thought their retiree coverage or their COBRA coverage allowed them the opportunity to delay enrollment into Medicare, and they faced the Medicare Part B penalty. If you're covered under a group health plan through your active employment or that of your spouse, you will be offered a special enrollment period or an SAP when you lose coverage from your employer health insurance plan. If you're leaving your employer coverage after you turn 65, you should start the process to enroll in Medicare 2 to 3 months prior to your retirement. Social Security is responsible for enrolling you into Medicare. There are 2 forms that you will need to activate your Medicare Part B coverage. These forms are a Part B application that you would complete, and then an employer verification form that your employer would complete. You will get these 2 forms completed, and then you will mail them or hand deliver them to your local Social Security office. Now remember that your Medicare coverage will always start the first of the month. Some employer plans will cover you to the end of the month that you leave, but the majority of employer plans will end their health insurance coverage the day that you leave employment. So make sure you understand that so you do not have a gap in coverage. Now Medicare and Health Savings Account have a very unique interaction. An employee is not eligible to have contributions put into an HSA if they are enrolled in another health plan. Enrollment in Medicare Part A and/or Part B qualifies as another health plan, and it disqualifies both the employee and the employer from contributing to an HSA. If an employee does elect Medicare Part A or Part B, they can still remain enrolled in the High Deductible Health Plan for medical benefits. The employee would be allowed to withdraw money from the HSA after they were enrolled in Medicare, or even while they're still covered under the High Deductible Health Plan, to help pay for qualified medical expenses. They just would not be eligible to have any contributions put into the HSA if they had that other health plan, which could be Medicare Part A and or Part B. If you are enrolled in a high deductible health plan with a health savings account through an employer, then you should not enroll in any part of Medicare. Enrollment in Medicare Part A is only required if you are collecting Social Security benefits. Otherwise, you can delay enrollment in Part A and Part B. You will be offered a special enrollment period to elect Medicare without a penalty when you lose your employer coverage. Now let's review the different Medicare enrollment periods. Your initial enrollment period is your 7-month window where you can enroll in Medicare Part A and Part B when you turn 65. A special enrollment period provides an opportunity to enroll in Medicare Part B, a Medicare Advantage plan, or a Medicare Part D plan. This is typically triggered by losing employer coverage, or when you're on a Medicare Advantage plan or Part D plan by moving out of the service area for that plan. Once someone is enrolled in Medicare, they would have the annual enrollment period, which is a 2-month window to change their Medicare Advantage plan or their Part D plan. This period runs between October 15th through December 7th. Additionally, Medicare has an open enrollment period that is a 3-month window where you can change your Medicare Advantage plan, or you can drop your Medicare Advantage plan and go back to original Medicare and enroll in a Part D plan. This time frame runs between January 1st and March 31st. My name is John Ebersol. I'm an independent Medicare advisor. My website is medicaremadness.com. You can email me at john@medicaremadness.com. You can call or text me at 717-798-1603. And please remember that there is no charge for this service. Thank you for listening. I hope this was valuable information for you. Have a great day.